If you're excited about ski season, maybe getting active, or if you just are getting out of bed in the morning and going, my back really hurts, we have some pain solutions for you today. Dr. Khan is here from Wasatch Pain Solutions. Hi there.
Hi, how are you guys doing?
Here.
Thank you for having us.
What kinds of pain are we talking about?
So we're talking about types of pains where we knee pain, shoulder pain, back pain, neck pain, other types of issues like ankle injuries, ACL injuries, etc. Different kind of ligament problems.
Well, so many of our viewers out there are going, yep, I have that one, a little bit of that one. What can you do about it other than surgery?
Well, so what we're kind of innovative in providing is a new type of stem cell therapy called Regenexx stem cell therapy. It's been processed out of Colorado for the last 10 years or so, and they're probably the leading experts in the world on stem cell therapy and teach about stem cell therapy around the world. So we kind of partnered with them to offer this care here in Utah so that we can actually eliminate or reduce the need for surgery.
And these stem cells are real stem cells. It's not a copy or a fake or something. They're real stem cells.
Correct. So they're your own cells, and that's the most safest usage of type of stem cell therapy that's out there. Other people have talked about amniotic or fat stem cell therapy. Those are really not really true to be real stem cells, as well as the fat is not as robust as for what the bone marrow offers.
Go back a little bit. What do those stem cells do in the healing process? How do they help?
So they do a lot of things, which is kind of the cool part of this. Is one of the issues is they encourage other cells to actually heal the area. They also cause the normal cells that are in that area to actually produce new cells. And then them themselves become the cells that also need to be addressed for the degeneration that's taking place.
What is the procedure? How do you get those stem cells? Say I have a shoulder pain. How would you help that shoulder?
So we would remove the bone marrow from your own hip area under anesthesia, and then we would concentrate that and then re-inject it several hours later after we process it.
And how quickly do you feel a difference and see a difference?
You know, most people notice 3 to 6 months is kind of the average, but it's very interesting that by the time they come back and finish the procedure, they're already noticing some improvement before they leave already.
Really?
And would you do it again, or do you just do it one time?
You can do it multiple times, but traditionally our algorithm is based on one treatment only, and our outcomes show that one treatment provides this pretty standard appropriate response.
Dr. Khan, how long have you worked with Regenexx, and how pleased are you at the results?
We've been doing it for about 2.5, 3 years now, and you know they didn't license this technology to physicians until about that time in 2012. So we've been lucky to be able to be one of the first clinics here in Utah to do this.
What's the most common procedure that you're doing? What area?
Knees. A lot of arthritis in knees.
Scott, if you're watching,
I know. I just said if
this
you
might
need
be a good
a
idea
test
for you.
subject, my husband would say, "I've done a lot of running. Now I'm in my 40s, and my knees hurt."
Sure.
Do you hear that all the time?
We do, and that's a common issue. We have lots of runners that come in. We have an ultra marathoner who came in and did his procedure and then was back to running 50, 60 miles within 3 months.
That's what I was going to say, the downtime then, for everyone that says, but I want to ski this season or I want to run, the downtime's not very long?
No, about 3 months is kind of our average results that we normally see. Now, there are other conditions that can be taking a little longer than that, like ACL injuries that might take a little bit longer to heal, but 6 months is kind of the average for those patients.
Where are your locations if people are thinking, I need to go get checked out and maybe need this procedure?
We are in South Jordan and in Pleasant Grove.
So all that is right there on your screen, everybody, along with the hours and the phone numbers. Go to goodforutah.com/GTU, and we will link you to Wasatch Pain Solutions. Dr. Khan is there, and of course, they can answer your questions if this is something that you've been thinking about. And really, I would think you tell patients, don't be in pain. Why? You shouldn't have to wake up every morning and say, I don't feel good.
There is help out there.
It is. There's a lot of help out there.
Thank you so much.
So nice to meet you.
Yep.
Okay, succulents are coming up next. How to put them together, Brian. Even though it's winter, I think they'd be cute in your home.
That's right. They're a beautiful addition to any home, and we'll talk more about that coming up. But if you don't have a green thumb,